in the coronary care unit of the cardiopulmonary department. Professor Verdejo is also a member of several medical societies, such as the American Society of Cardiology. He is the current president. The National Academy of Medicine of Mexico, of the Mexican Council of Cardiology. He is a former president of that organization. Of the American College of Cardiology, he's a fellow. And the American Heart Association, he's also a fellow. He also works at the Advisory Council of the General Salubrity of Mexico and in the Federal Council for the Prevention of Sanitary Risks. He has published over 50 international peer-reviewed papers in the field of ischemic heart disease, valvular heart disease, hypertension, and dyslipidemia. Welcome, Professor.
Thank you, Professor Laclette. First of all, I would like to thank this kind invitation to present to you in this forum what, well, an overview of what we are doing for chronic heart diseases. And we have focused on hypertension. This is a work that was done along with the National Institute of Public Health in Mexico with Dr. Simon Barquera and Dr. Ismael Campos. I will give you some background of why we have selected hypertension, the general concepts of it, what are the interventions we have been doing in Mexico, and what are the conclusions we have been reaching at. When we examine the main mortality causes in Mexico, the main mortality cause in Mexico is right now diabetes mellitus. Type 2 diabetes mellitus is the leading cause of mortality, but we have to remember that people that die from diabetes mainly die from cardiovascular causes. So when we consider the high blood glucose, also the obesity that we have in the country, both leads to high blood pressure. And it is known by the World Health Organization that the hypertension diseases is the main cause of mortality along the world. The diseases related to hypertension are the main cause of mortality along the world without taking into account the social, the economic, or anything that can be done with that. And also we have alcohol use, and also low fruit and vegetable intakes, physical inactivity, and high cholesterol. And all these causes are related to lifestyle that we have right now in Mexico. And we have to take into account the changes that Dr. Moncayo said us at the beginning, that we are paying the social changes we have in Mexico in the last 50 years. 50 years ago, 75% of our population was rural, and only 25% was urban population. Right now, we have inverted this relationship. We have now 75% of our population, over 100 million people in Mexico, in the urban areas. And this change in lifestyle has led to the both things, to the development of non-communicable diseases, because this population has better health services, that we are very good at treating complications of these diseases. The people does not die right now from the first myocardial infarction. We do not know maybe hypertensive crisis or diabetic coma. These are become very scarce in our population. But as long as we have a very long life expectancy, 77 years, as you have seen right now, we are paying the cost of developing chronic diseases that will take a lot of our resources from the health public system, and also to cope with diseases that have very much incidence in disabilities along these years. When we see we think about background from blood pressure, We have known from the Framingham study that blood pressure increases continuously with age. And if we take into account this premise, people with normal blood pressure that goes to age 55 and over after that carry a 90% risk of becoming hypertensive. So it's very, the incidence of hypertension is very high. And also a number of studies have demonstrated that cardiovascular disease mortality increases progressively as the levels of blood pressure raises. And this is valid for any decade of age. Even you have 50 to 59, and considering stroke mortality or ischemic heart disease mortality, as if the blood pressure increases, the mortality also increases along, both in this decade of age and also in between the age of 80 to 89. So what we need to cope is to lower this blood pressure in order to avoid these conditions. The lifestyle modification can reduce the risk of developing hypertension, yes. We have seen from several studies that if we lose weight, if we do more exercise, if we employ this kind of diet, the DASH diet or similar, we reduce the salt intake, we reduce the alcohol intake, and also stop smoking, as has been said, we can reduce hypertension. Along with that, we can reduce the cardiovascular diseases. What are we seeing in Mexico right now? We are becoming more obese. When we compare the surveys done in 1988, 1999, and 2006, you can see that the majority of the population has moved from a normal body mass index to an overweight body mass index, and we are approaching to obesity very fast. And this condition is leading to developing a number of chronic diseases. Let's see what has happened with hypertension according to the last survey done in 2006. The overall prevalence of hypertension is over 31% of the population. A little bit less in women, a little bit more in men. But the main problem that we may have is almost half of them didn't know they have hypertension. This was a diagnosis made during the survey, and the main problem that we may have is that even when they know that they have hypertension, less than half of these patients have taken medication. And if they haven't taken medication, less than half of this population are controlled, as we will see a little bit later. Besides, when we correlate obesity, overweight with hypertension, you can see with a normal body mass index, only a little bit less than 20% have hypertension. If we are overweighted, 31.7, let's say, the mean average of our population. But when we go to obesity, almost 44% of the population with obesity has also hypertension. Two risk factors that lead to diabetes and also cardiovascular disease. The metabolic syndrome, one thing that some people say it doesn't exist, some people say they do, but don't worry. What we can see is several characteristics that increases the risk for a patient to develop cardiovascular disease. When we use the definition for the ATP3 modified, 42.3% of our population will have metabolic syndrome. With the definition before that, it was 33%. For this population, hypertension goes to 45%. Plus abnormal fasting glucose plus diabetes mellitus accounts for 12.7%, more than double, let's say, at developed countries like the United States of America. We have a huge problem with diabetes. Besides that, if we see that with low HDL, that is considered a protective factor for cardiovascular disease, we have a huge number of population, over 2/3 of our population has low HDL. If we go to high triglyceride, almost 42% of our population has this condition. If we consider just abdominal obesity, that goes over 90 centimeters, about 34 inches of waist, almost 70% of our population has gone over that figure. Obesity accounts for almost 1/3 of population, and overweight almost to 40%. When we try to control hypertension, if we can see, around 50% of our population is under control. But the control is even more difficult as long as we have overweight or obesity. And it's weaker, the control among the male population. What can we do from this standpoint? We have used weight control to do more exercise, stop smoking, and to take a balanced food intake.